Caring for patients' recovery, how we support you safely. I did an anesthesiology externship when I was done with dental school. I was one of 2 selected to go to Southwestern Medical School and do anesthesia training. And we learned that in the medical world, an anesthesiologist is critical to monitor that patient when they're sedated. In dentistry, we sedate the patient and do the surgery, which is not good. That's too much to keep track of for one person. So anytime we do a surgery, an anesthesiologist, an MD, comes to the office. You're sedated by someone who's watching your vital signs, whose one job is to keep you safe. The dentist, me, I get to operate without worrying about your overall health because the physician has that. So I can focus on where those teeth need to be, where those implants need to be so that the teeth can be there, and everything that goes along with a complex surgery, and not have to try to do 2 things at once the way most of our colleagues out there are doing it. As far as radiation goes, we need to know the total dose. If you've had cancer of the head and neck, and mouth is dry as a result, we need to know the total dose of radiation you've had. There's a certain number that if we're below, we know the bone will heal beautifully to a dental implant. And there's a certain number that you won't heal as well. So that total dose, and if you were shielded or not, are critical steps to allowing us to advise you well on if you should move forward with surgery or not.